151. Hyperthyroidism can cause goiter formation. True or false? Answer: true. Rationale: hyperthyroidism, especially in Graves' disease, can cause goiter due to thyroid overstimulation, requiring antithyroid therapy to reduce gland size and function. 152. Type 1 diabetes can be cured with insulin therapy. True or false? Answer: false. Rationale: type 1 diabetes is managed, not cured, with insulin therapy, as it results from permanent beta cell destruction, requiring lifelong treatment for glycemic control. 153. Hypothyroidism can cause weight loss. True or false? Answer: false. Rationale: hypothyroidism reduces metabolism, leading to weight gain, not loss, requiring levothyroxine to restore metabolic rate and manage body weight effectively. 154. Glucagon can be administered orally for hypoglycemia. True or false? Answer: false. Rationale: glucagon is administered intramuscularly or subcutaneously for hypoglycemia, as oral administration is ineffective, ensuring rapid glucose elevation in emergencies. 155. Adrenal crisis can cause hypoglycemia. True or false? Answer: true. Rationale: adrenal crisis reduces cortisol, impairing gluconeogenesis and causing hypoglycemia, requiring hydrocortisone to restore glucose levels and prevent complications. 156. Hemoglobin A1C should be checked daily in diabetic patients. True or false? Answer: false. Rationale: hemoglobin A1C is checked every 3 to 6 months to assess long-term glucose control, not daily, which relies on fingerstick glucose monitoring for immediate management. 157. Hyperparathyroidism can cause seizures. True or false? Answer: false. Rationale: hyperparathyroidism causes hypercalcemia, not seizures, which are more associated with hypocalcemia from hypoparathyroidism, requiring distinct management. 158. Insulin is required for all patients with gestational diabetes. True or false? Answer: false. Rationale: gestational diabetes is often managed with diet and exercise, with insulin used only if glycemic control is inadequate, ensuring maternal and fetal safety. 159. Cushing syndrome can cause osteoporosis. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome increases bone resorption, causing osteoporosis, requiring monitoring and cortisol-lowering therapies to prevent fractures. 160. Diabetes insipidus can cause dehydration. True or false? Answer: true. Rationale: diabetes insipidus causes excessive water loss due to antidiuretic hormone deficiency, leading to dehydration, requiring desmopressin and hydration for balance. 161. Propylthiouracil is used to treat hypothyroidism. True or false? Answer: false. Rationale: propylthiouracil treats hyperthyroidism by inhibiting thyroid hormone synthesis, while hypothyroidism requires levothyroxine to replace deficient hormone. 162. Diabetic ketoacidosis can cause fruity breath odor. True or false? Answer: true. Rationale: diabetic ketoacidosis produces ketones, causing fruity breath odor, a diagnostic clue requiring insulin and fluids to reverse acidosis and restore stability. 163. Pheochromocytoma can cause weight gain. True or false? Answer: false. Rationale: pheochromocytoma causes weight loss due to catecholamine-induced metabolism increase, requiring surgical removal to manage symptoms and prevent complications. 164. Hypoglycemia can cause tremors in diabetic patients. True or false? Answer: true. Rationale: hypoglycemia triggers sympathetic activation, causing tremors, requiring rapid carbohydrate administration to restore glucose and prevent neurological harm. 165. The pituitary gland secretes aldosterone. True or false? Answer: false. Rationale: the pituitary gland secretes ACTH, which stimulates aldosterone production by the adrenal gland, a distinction critical for endocrine disorder management. 166. Hyperaldosteronism can cause hypertension. True or false? Answer: true. Rationale: hyperaldosteronism increases sodium retention, raising blood pressure, requiring aldosterone antagonists to manage hypertension and cardiovascular risks. 167. Type 2 diabetes can be managed with metformin. True or false? Answer: true. Rationale: metformin improves insulin sensitivity in type 2 diabetes, a first-line treatment to control glucose and prevent complications, tailored to patient needs. 168. Myxedema coma can cause hypothermia. True or false? Answer: true. Rationale: myxedema coma, a hypothyroidism emergency, reduces metabolism, causing hypothermia, requiring levothyroxine and warming measures to stabilize temperature. 169. Hyperthyroidism can cause fatigue. True or false? Answer: true. Rationale: hyperthyroidism overstimulates the body, leading to fatigue from energy depletion, requiring antithyroid therapy to restore endocrine balance and energy levels. 170. Insulin is secreted by pancreatic alpha cells. True or false? Answer: false. Rationale: insulin is secreted by pancreatic beta cells, while alpha cells secrete glucagon, critical for understanding glucose regulation in endocrine disorders. 171. Diabetic neuropathy can cause loss of sensation. True or false? Answer: true. Rationale: diabetic neuropathy damages nerves, causing loss of sensation, increasing injury risk, and requiring foot care education to prevent complications like ulcers. 172. Desmopressin is used to treat Cushing's disease. True or false? Answer: false. Rationale: desmopressin treats diabetes insipidus, while Cushing's disease requires cortisol-lowering therapies like surgery or ketoconazole to manage excess cortisol. 173. Hypoparathyroidism can cause tingling in extremities. True or false? Answer: true. Rationale: hypoparathyroidism causes hypocalcemia, leading to tingling from nerve irritability, requiring calcium supplementation to prevent neurological complications. 174. Blood glucose monitoring is unnecessary for prediabetes management. True or false? Answer: false. Rationale: blood glucose monitoring helps track prediabetes progression, guiding lifestyle changes to prevent type 2 diabetes and ensure long-term endocrine health. 175. Thyroid storm can cause coma. True or false? Answer: true. Rationale: thyroid storm, a hyperthyroidism crisis, can cause coma due to metabolic overload, requiring urgent antithyroid drugs and supportive care to prevent death. 176. Acromegaly can cause heart enlargement. True or false? Answer: true. Rationale: excess growth hormone in acromegaly causes cardiac hypertrophy, increasing heart size, requiring pituitary treatment to prevent cardiovascular complications. 177. Insulin should be injected into scar tissue for optimal absorption. True or false? Answer: false. Rationale: insulin should be injected into healthy tissue, as scar tissue impairs absorption, reducing efficacy and complicating glycemic control in diabetes management. 178. Addison's disease can cause hypotension. True or false? Answer: true. Rationale: Addison's disease reduces cortisol and aldosterone, causing hypotension from sodium loss, requiring hormone replacement to stabilize blood pressure. 179. Patients with diabetes insipidus require fluid restriction. True or false? Answer: false. Rationale: diabetes insipidus causes water loss, requiring adequate hydration and desmopressin to prevent dehydration and maintain fluid balance safely. 180. Methimazole can cause rash as a side effect. True or false? Answer: true. Rationale: methimazole, used for hyperthyroidism, can cause rash, requiring monitoring and possible drug change to ensure patient safety and treatment adherence. 181. Diabetic retinopathy can cause floaters in vision. True or false? Answer: true. Rationale: diabetic retinopathy causes retinal hemorrhages, leading to floaters, requiring tight glucose control and ophthalmologic intervention to preserve vision. 182. The adrenal gland secretes antidiuretic hormone. True or false? Answer: false. Rationale: the adrenal gland secretes cortisol and catecholamines, while antidiuretic hormone is secreted by the pituitary, critical for accurate endocrine management. 183. Hypothyroidism can cause memory impairment. True or false? Answer: true. Rationale: hypothyroidism slows brain metabolism, causing memory impairment, requiring levothyroxine to restore cognitive function and improve quality of life. 184. Administering insulin to a patient with a blood glucose of 90 mg per deciliter is always appropriate. True or false? Answer: false. Rationale: a blood glucose of 90 mg per deciliter is normal, and insulin may not be needed, depending on the patient's plan, to avoid hypoglycemia and ensure safety. 185. Prolactinomas can cause headaches. True or false? Answer: true. Rationale: prolactinomas, pituitary tumors, can cause headaches from mass effect, requiring dopamine agonists or surgery to relieve pressure and manage symptoms. 186. Hyperglycemia can cause thirst in diabetic patients. True or false? Answer: true. Rationale: hyperglycemia causes osmotic diuresis, leading to thirst from dehydration, requiring insulin to control glucose and restore fluid balance. 187. Hypophysectomy can cause adrenal insufficiency. True or false? Answer: true. Rationale: hypophysectomy removes the pituitary, reducing ACTH and causing adrenal insufficiency, requiring cortisol replacement to maintain endocrine function. 188. Type 1 diabetes can cause hyperosmolar hyperglycemic state. True or false? Answer: false. Rationale: hyperosmolar hyperglycemic state is typical of type 2 diabetes, while type 1 diabetes is more associated with diabetic ketoacidosis due to insulin deficiency. 189. Hyperparathyroidism can cause abdominal pain. True or false? Answer: true. Rationale: hyperparathyroidism causes hypercalcemia, leading to abdominal pain from pancreatitis or ulcers, requiring calcium management to alleviate symptoms. 190. Cushing's syndrome can cause hirsutism. True or false? Answer: true. Rationale: excess cortisol in Cushing's syndrome increases androgen production, causing hirsutism, requiring cortisol-lowering therapies to manage symptoms. 191. Levothyroxine can cause hair loss as a side effect. True or false? Answer: false. Rationale: levothyroxine treats hypothyroidism, which causes hair loss, and proper dosing improves hair growth, not worsens it, ensuring endocrine balance. 192. Diabetic ketoacidosis can cause rapid breathing. True or false? Answer: true. Rationale: diabetic ketoacidosis causes Kussmaul respirations to compensate for acidosis, requiring insulin and fluids to correct pH and stabilize breathing. 193. Adrenal crisis can cause hyperkalemia. True or false? Answer: true. Rationale: adrenal crisis reduces aldosterone, causing potassium retention and hyperkalemia, requiring hydrocortisone and fluids to restore electrolyte balance. 194. A fasting blood glucose of 100 mg per deciliter confirms diabetes mellitus. True or false? Answer: false. Rationale: a fasting blood glucose of 126 mg per deciliter or higher confirms diabetes, while 100 to 125 mg/dl indicates prediabetes, guiding appropriate management. 195. Hyperthyroidism can cause anxiety. True or false? Answer: true. Rationale: hyperthyroidism increases metabolism, stimulating the nervous system and causing anxiety, requiring antithyroid therapy to restore emotional stability. 196. Patients with diabetes insipidus have low serum sodium. True or false? Answer: false. Rationale: diabetes insipidus causes water loss, increasing serum sodium, hypernatremia, requiring desmopressin to restore fluid balance and normalize sodium. 197. Type 2 diabetes can be managed with insulin pumps. True or false? Answer: true. Rationale: insulin pumps can be used in type 2 diabetes for intensive insulin therapy when oral agents fail, ensuring precise glycemic control and patient safety. 198. Hypothyroidism can cause bradycardia. True or false? Answer: true. Rationale: hypothyroidism slows metabolism, reducing heart rate and causing bradycardia, requiring levothyroxine to restore cardiovascular function and stability. 199. Administering desmopressin can cause seizures. True or false? Answer: true. Rationale: desmopressin can cause hyponatremia from excessive water retention, lowering seizure threshold, requiring sodium monitoring to ensure neurological safety. 200. Cushing syndrome can cause moon phases. True or false? Answer: true. Rationale: excess cortisol in Cushing syndrome causes fat redistribution, leading to moon phases, requiring cortisol-lowering therapies to manage physical changes.